Hello and welcome. My name is Mark Squires, Environmental Health and Safety Advisor with U.S. Compliance Corporation, and today we're going to be discussing back safety. Specifically, we are going to discuss today anatomy and statistics regarding back injuries. We're going to talk about some common back disorders and what the causes of some of those back problems are. We're also going to discuss methods for reducing risk to your back, to include mechanical substitution, some basics on back injury prevention, and finally, we're going to round today's training out with safe lifting techniques. Let's get started with anatomy and statistics. When discussing the anatomy of the back, it's important that you understand that the human back is made up of several key parts. We have bones, joints, discs, muscles, ligaments, and nerves. And you'll see some images as we work our way through this presentation that highlight these areas of your back. As you can see by the diagram on the right-hand side of the slide, the human back is broken down into 5 specific segments. That is the cervical, thoracic, lumbar, sacral, and coccygeal. Based off the pie chart you see on the left-hand side of the slide, the majority of back injuries occur in the lumbar section of the spine. That is a lower back injury. Alright, some more statistics related to back injuries. Approximately 80%, that's 8 in 10 persons, 80% of the population can expect to have back pain that will impair activity. About 8 million Americans suffer new back injuries every year. Twice as many back injuries occur at home as in the workplace. Now that's a deceiving number right there. Attributed to a couple factors. First, a lot of times back injuries are a result of cumulative trauma, meaning it's not necessarily a single event that winds up resulting in that herniation or that sprain. The other factor that plays into that is in the workplace, when you're doing physical activities, oftentimes there are tools that we'll discuss later on in this presentation, such as forklifts, cranes, hand carts, etc., that are designed to prevent that strain on your back. You don't often have access to those types of tools in the home, which leads to greater risks being taken by individuals with regards to lifting heavy loads or awkward loads. Finally, 400,000 people will suffer disabling back injuries every year. Now let's talk about some common back disorders. First off, we have back strains. Now, back strains and back sprains are very similar. Here's the difference between the two. A back strain is going to affect your muscles or your tendons, okay? Whereas a back sprain is going to affect your ligament. And so regardless of whether it's a muscle or a tendon or a ligament, twisting, pulling, tearing, or stretching of any of those components of your back can result in a back sprain or a back strain. Symptoms of sprains and strains include pain that worsens with movement. It can often be characterized by muscle cramping or sometimes muscle spasms. And individuals who incur a strain or a sprain often realize a decreased function or range of motion. Another type of common back injury is a herniated disc. If you recall from earlier, a disc is what separates your vertebrae. They act as a cushion of sorts between those bones. Now, in order to understand what a herniated disc is, we need to understand the different components that I'm going to be talking about. So if you take a look in the lower right-hand corner of this slide, you'll see a portion of a disc broken down. It's cross-section. It says the nucleus, which is the inner portion, and the annulus, which is the outer portion. Now, what a herniated disc is it occurs when the pressure from the vertebrae above and below, so we're talking about some type of uneven pressure here. The vertebrae above and below force some or all of the nucleus through a weakened or torn part of the annulus. Now you can see here in the upper portion of the image on the right hand side, you can take a look at what actually happens there. So you can see the inner portion pushing out through, and what it does is it causes a pinching sensation on the nerves of your spinal cord, which we interpret as pain. Symptoms of a herniated disc differ a little bit depending on where in your back that herniation occurs. Signs and symptoms of a herniated disc in your lower back include pain that radiates to the buttocks, legs, and feet. It can often involve some tingling or numbness in your lower extremities, and it's also going to produce some significant muscle weakness. Now, a herniated disc in the upper portion of your back is going to be represented by pain near or over top of your shoulder blades, pain that radiates to the shoulder, arms, and hands. You may experience neck pain, especially in the back and on the sides. And also common with upper back herniations is spasms of the neck muscles. Now we are going to discuss the causes of back problems. Specific contributors to back injuries include heavy, repetitious lifting, poor lifting posture, such as bending at the waist, twisting while lifting is a major contributor to a number of back injuries, as is maintaining prolonged, awkward postures. Overreaching, especially when the item we're reaching for is either awkwardly shaped, excessively large, or overly heavy, can contribute to back injuries, as can maintaining poor muscle tone of your midsection. So now that we've discussed some of the causes of back problems, let's talk about some methods to prevent back injuries. The first method that we can employ in order to reduce the risk of a back injury is to stretch. By performing stretching exercises before, during, and after performing work, you can significantly reduce the risk of incurring a back injury. Maintaining proper conditioning can also reduce the risk of a back injury. Exercises focused on the back, abdomen, and gluteus areas relieve the stress on your spine. There's not a whole lot of bone support between your rib cage and your hips, and so it's important that these muscles be properly toned in order to alleviate the strain on your spine. Maintaining proper posture is also another method which can help to reduce the risk of a back injury. The reason being is because poor posture places unnecessary stress on your body, which includes your spine. Practicing proper posture alleviates the stress, and it reduces your risk of a back injury. Workplace design is another critical factor in the reduction of back injuries. Specifically, storing heavy and/or frequently accessed items inside of the power zone or the strike zone reduces unnecessary bending and reaching. When you're reaching for heavy objects that are overhead, or you have to squat down low in order to access a material, you're placing an unnecessary stress on your body that could be alleviated simply by storing those materials that are frequently accessed in this neutral power zone or strike zone. Another very common practice that can increase your risk of a back injury is sitting on the bulky wallet. Sitting on a wallet causes misalignment of the spine, which in turn increases your risk of a back injury. In the image on the right-hand side of the slide, you can see we have an individual not sitting on a wallet, and the spine is nicely aligned. It's in a neutral position. Whereas to the right of that, you can see what sitting on a wallet does to your spine. It causes misalignment from top through bottom, which places stress on your nerves, your tendons, your discs, and can eventually be a contributing factor in a back injury. Another way that we can reduce the risk of a back injury is to utilize mechanical substitution when available and feasible. Mechanical substitution is what I like to call working smarter, not harder. And so by utilizing tools such as cranes, forklifts, dollies, carts, in place of brute effort, we are reducing risk when it is feasible to do so. With regards to mechanical substitution, when we're talking about using some type of a hand cart, we want to stack heavier and larger objects at the bottom of it. What this does is it gives us more leverage over that load. We also always want to push a load. We don't want to pull it. And so whether it's a hand cart, a dolly, or a manual pallet jack, we want to push it because it offers greater control and it reduces the strain that's going to be imparted onto your back as a result of utilizing that mechanical substitution. So when all else fails and we have to make the lift, let's talk about how to do so in a safe manner in order to minimize any type of risk to your back. So the first step is to size up the lift. Some factors to consider while doing so includes knowing the weight of the box, assessing the size, determining whether or not you can get a good grip on it, and determining how far you need to travel with that load. And again, ask yourself, is there an easier way? Can we utilize some type of mechanical substitution, such as a pallet jack, a cart, a forklift, a crane? Or if it's an awkward or excessively heavy load and those mechanical substitution means are not feasible, we want to employ team lifting in order to help distribute the weight and reduce the risk of injury. Now, when lifting the load, a couple tips we want to keep in mind are, first, we need to make sure our feet are approximately shoulder width apart. This gives you a nice wide stance, and it gives you a lot of balance to prevent you from potentially falling over. Kneel or squat close to the load, making sure you get a good grip on that load. When you lift, through all stages of the lift and while transporting the load, you want to keep that load as close to your body as possible. And on the actual lift, we want to make sure you lift smoothly, keeping your back straight. We want to keep your back in a neutral position. It's going to impart the least amount of stress onto you. Again, the whole purpose is to help reduce the risk of a back injury. Some things we want to keep in mind while transporting the load include we want to control the load with your stomach and arm muscles. If you recall earlier, we talked about proper conditioning and making sure that your core is toned. This will help reduce that risk. So we also want to keep the load close to your body, and you always want to pivot the turn, as you can see in the lower left-hand side of the slide. You never want to twist while carrying the load. It's basically causing your vertebrae to grind away at your discs, creating a weak spot, which could in turn result in a herniated disc. So as far as depositing the load is concerned, we're basically reversing our lifting steps. So what we want to do is we want to bend at the knees. We want to smoothly set the load onto the intended surface, making sure you're not tossing the load, because this can cause some awkward twisting of the back, which could be that event that winds up causing that sprain, that strain, that herniation, which we're trying to avoid. Okay, so in summary, we want you to avoid high-risk behaviors such as reaching or lifting by bending at your back. We want to make sure you are stretching and maintaining good physical conditioning. If it's available, utilize mechanical substitution to transport that load. And if all else fails and we do actually have to perform a lift, we want to make sure we're utilizing the proper lifting techniques described in today's presentation. This concludes today's presentation on back safety. I want to thank you for your attendance and hope that you were able to take away some lessons that you can apply in your workplace in order to reduce the risk of a potentially debilitating back injury. Thank you very much.